Question 1. Market research demonstrates a growing availability of advanced wearable devices and AI-powered software platforms that claim to offer sophisticated exercise assessment capabilities and personalized programming recommendations for individuals with medical conditions. As a medical exercise program director, MEPD, what is the most appropriate regulatory compliant approach to evaluating and potentially integrating these technologies into your practice? Option A. Immediately implement the most technologically advanced and widely marketed wearable devices and AI platforms to ensure the program remains at the forefront of innovation and client engagement. Option B. Utilize new assessment technologies and programming software based primarily on anecdotal evidence from other fitness professionals and positive marketing testimonials, assuming they are generally safe and effective. Option C. Prioritize adopting technologies that have undergone rigorous independent scientific validation and have clear data privacy and security protocols that align with relevant health regulations, ensuring their suitability for the specific client population served. Option D. Integrate any new technology that offers a perceived improvement in data collection, regardless of its scientific backing or regulatory compliance, to provide clients with the most comprehensive data possible. The correct answer is C. Prioritize adopting technologies that have undergone rigorous independent scientific validation and have clear data privacy and security protocols that align with relevant health regulations, ensuring their suitability for the specific client population served. Explanation. The scenario presents a common challenge for a medical exercise program director, MEPD, where emerging technologies offer potential benefits for client assessment and programming, but also introduce regulatory and ethical considerations. The professional challenge lies in balancing innovation with the imperative to adhere to established standards of care, data privacy, and client safety, all within the specific regulatory framework governing MEPD. Careful judgment is required to discern which technological applications are appropriate, validated, and compliant, ensuring that client well-being and program efficacy are prioritized. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and compliant integration of technology. This involves thoroughly vetting any new technology against established scientific literature and regulatory guidelines relevant to exercise science and healthcare. It ensures that the technology is not only effective, but also safe, reliable, and respects client privacy and data security, aligning with the core responsibilities of an MEPD to provide safe and effective exercise interventions. This approach demonstrates a commitment to professional development and responsible adoption of tools that enhance client care without compromising ethical or legal obligations. An incorrect approach that involves adopting a new wearable device solely based on its marketing claims without independent validation or consideration of data privacy protocols would represent a significant regulatory and ethical failure. This could lead to the collection of inaccurate or irrelevant data, potentially resulting in inappropriate exercise programming and client harm. Furthermore, it could violate data protection regulations if client information is not handled securely. Another incorrect approach, such as relying on unverified software for exercise prescription without understanding its underlying algorithms or its suitability for specific medical conditions, poses risks of ineffective or even dangerous programming. This disregards the MEPD duty to ensure that all programming is evidence-based and tailored to individual client needs and limitations, potentially violating professional standards and leading to adverse outcomes. The professional reasoning process for similar situations should involve a multi-step evaluation. First, identify the potential benefit of the technology to client assessment or programming. Second, conduct a thorough review of the scientific literature to assess the technology's validity, reliability, and efficacy. Third, investigate the regulatory compliance of the technology, particularly concerning data privacy, e.g., HIPAA in the U.S. context, or equivalent regulations in other specified jurisdictions, and any specific certifications or approvals required for medical devices or health-related software. Fourth, consider the practical implementation, including cost, ease of use, and the need for staff training. Finally, always prioritize client safety, informed consent, and the ethical implications of using the technology, ensuring it enhances, rather than compromises, the quality of care provided. Question 2. Which approach would be most appropriate for a medical exercise program director? MEPD. When a client reports new onset of shortness of breath and increased fatigue during a prescribed exercise session, symptoms that were not present in previous sessions and are not typical for their diagnosed condition. Option A. Attempt to identify the specific respiratory condition causing the symptoms through a series of specialized breathing tests. Option B. Continue with a modified, lower-intensity exercise session, closely monitoring the client's symptoms, and advise them to report any worsening. Option C. Advise the client to rest completely and suggest they try to push through the symptoms in their next session, as it might be a temporary issue. Option D. Immediately refer the client to their physician for further medical evaluation and await their guidance before continuing or modifying the exercise program. Correct answer is D. Immediately refer the client to their physician for further medical evaluation and await their guidance before continuing or modifying the exercise program. Explanation. Scenario analysis. This scenario presents a common challenge for a medical exercise program director, MEPD, where a client exhibits symptoms that could indicate compromised gas exchange, potentially impacting their safety and the efficacy of their prescribed exercise program. The MEPD must balance the client's desire to exercise with the paramount responsibility of ensuring their well-being and adhering to professional standards of care. The challenge lies in accurately assessing the situation without overstepping the scope of practice and knowing when to escalate care appropriately. Correct approach analysis. The correct approach involves a systematic, evidence-based evaluation that prioritizes client safety and adheres to established medical exercise guidelines. This includes a thorough subjective assessment to gather information about the client's symptoms, medical history, and current functional status. Objective measures such as vital signs, respiratory rate, oxygen saturation if available and within scope, and observation of breathing patterns are crucial. Crucially, this approach recognizes the limitations of the MEPD scope of practice and mandates referral to a qualified healthcare professional when there is suspicion of a significant underlying medical condition affecting gas exchange. This aligns with the ethical and regulatory imperative to practice within one's competence and to ensure clients receive appropriate medical attention when needed. The MEPD role is to facilitate safe and effective exercise within the context of a diagnosed medical condition, not to diagnose or manage acute medical issues. Incorrect approaches analysis. One incorrect approach involves proceeding with the exercise program without further investigation or consultation, assuming the symptoms are minor or unrelated to gas exchange. This is a significant regulatory and ethical failure as it disregards potential underlying pathology that could be exacerbated by exercise, leading to adverse events. It violates the duty of care and the principle of do no harm. Another incorrect approach is to immediately cease all exercise and recommend complete rest without a proper assessment or referral. While caution is warranted, an abrupt cessation without professional medical evaluation can be detrimental and may not be necessary. This approach fails to utilize the MEPD expertise in modifying exercise safely and instead abdicates responsibility to a physician without providing them with sufficient information. A third incorrect approach is to attempt to diagnose the specific cause of the compromised gas exchange. This is a direct violation of the MEPD scope of practice, which is focused on exercise prescription and management, not medical diagnosis. Such an action constitutes practicing medicine without a license and poses a serious risk to the client. Professional reasoning. When faced with a client exhibiting symptoms potentially related to gas exchange, a professional MEPD should employ a structured decision-making process. This begins with a comprehensive subjective and objective assessment to gather relevant data. The MEPD must then critically analyze this data in the context of the client's known medical conditions and the established parameters of their exercise program. If the assessment reveals any signs or symptoms suggestive of compromised gas exchange that are outside the expected norms for the client's condition or that raise safety concerns, the immediate and appropriate professional action is to refer the client to their physician or another qualified healthcare provider for further evaluation. The MEPD should document the observed symptoms and the rationale for the referral. Following the referral, the MEPD should await guidance from the healthcare provider before modifying or continuing the exercise program. This systematic approach ensures client safety, upholds professional integrity, and complies with regulatory requirements. Question 3. The review process indicates a client participating in a medical exercise program reports experiencing significant muscle fatigue during exercises designed to improve muscular endurance, specifically noting that their legs feel heavy and slow to recover after even moderate exertion. The client expresses a desire to feel more explosive and powerful in their daily activities. As the medical exercise program director, MEPD, how should you ethically and professionally address this discrepancy between the client's reported experience and their stated goals, considering the distinct roles of slow-twitch and fast-twitch muscle fibers? Option A. Focus exclusively on high-intensity, plyometric-style exercises to directly address the client's desire for explosiveness, disregarding the reported fatigue during endurance work as a secondary concern that will resolve once they achieve their power goals. Option B. Immediately increase the intensity and volume of the endurance-focused exercises to push the client past their perceived fatigue, believing that this will condition their slow-twitch fibers to become more resilient and ultimately lead to improved power output. Option C. Advise the client that their current symptoms are likely due to a lack of conditioning and suggest they simply push through the discomfort during their endurance workouts, as this is the only way to build the necessary foundation for future power development. Option D. Conduct a detailed functional movement assessment to evaluate the client's current strength, endurance, and power capabilities across different muscle groups, and then design a progressive program that strategically incorporates exercises targeting both slow-twitch, endurance, and fast-twitch power, muscle fiber recruitment, explaining to the client how this balanced approach will address their fatigue and improve overall functional explosiveness. The correct answer is D. Conduct a detailed functional movement assessment to evaluate the client's current strength, endurance, and power capabilities across different muscle groups, and then design a progressive program that strategically incorporates exercises targeting both slow-twitch endurance and fast-twitch power, muscle fiber recruitment, explaining to the client how this balanced approach will address their fatigue and improve overall functional explosiveness. Explanation. This scenario presents a professional challenge because it requires the medical exercise program director, MEPD, to balance the immediate perceived needs of a client with the established scientific understanding of muscle physiology and the ethical imperative to provide safe and effective exercise programming. The MEPD must exercise sound judgment to avoid overpromising or implementing potentially harmful interventions based on incomplete or inaccurate client self-assessment. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the client's condition before designing an exercise program. This aligns with the fundamental principles of medical exercise, which emphasize individualized programming based on physiological assessment and understanding of muscle types and their specific functions. By focusing on the client's reported symptoms and then systematically evaluating the underlying muscle function, e.g., identifying potential weaknesses or imbalances in slow-twitch vs. fast-twitch fibers or the role of stabilizer muscles, the MEPD ensures the program is tailored to address the root cause of the discomfort and improve functional capacity safely. This approach upholds the ethical duty of care and professional responsibility to provide competent and evidence-based guidance. An incorrect approach that focuses solely on the client's subjective report of muscle fatigue without further investigation would be professionally unacceptable. This fails to acknowledge the diverse roles of different muscle fiber types, e.g., slow-twitch for endurance, fast-twitch for power, and their specific responses to exercise. It could lead to an inappropriate program that exacerbates the underlying issue or fails to address it effectively, potentially violating the principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. Another incorrect approach that immediately prescribes high-intensity, power-focused exercises based on the client's desire to feel stronger, without assessing their current capacity or the specific muscle groups involved, would be a significant regulatory and ethical failure. This ignores the potential for overtraining, injury, and the fact that different muscle types require different training stimuli. It prioritizes client desire over scientific principles and professional expertise, potentially leading to adverse outcomes and a breach of professional standards. A third incorrect approach that dismisses the client's concerns entirely and refuses to modify the program without a formal medical diagnosis would also be professionally problematic. While a formal diagnosis is valuable, A skilled MEP should be able to assess functional limitations and muscle imbalances based on exercise science principles, even without a specific medical label. This approach could be seen as a failure to engage with the client's experience and a missed opportunity for intervention within the scope of practice. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and empathetic engagement with the client's reported concerns. 2. Comprehensive assessment of the client's current functional status, including movement patterns, strength, endurance, and flexibility, considering the roles of different muscle fiber types and muscle groups. 3. Application of exercise science principles to interpret assessment findings and identify potential underlying physiological issues related to muscle function. 4. Development of an individualized, evidence-based exercise program that addresses identified needs and aligns with the client's goals, while prioritizing safety and efficacy. 5. Ongoing monitoring and reassessment to track progress and make necessary adjustments to the program. 6. Clear and transparent communication with the client regarding the rationale behind the program design and any limitations. Question 4. The analysis reveals that a client presents with a diagnosed peripheral artery disease, which significantly impacts blood circulation to their lower extremities. As a medical exercise program director, MEPD, how should the physiological implications of this condition be primarily addressed when designing an exercise program to optimize blood flow and minimize risk? Option A. Recommend static stretching exercises for the lower extremities to improve flexibility, assuming that increased range of motion will indirectly benefit circulation. Option B. Focus on high-intensity interval training, HIIT, to rapidly increase heart rate and stroke volume, aiming to overcome circulatory limitations through sheer force of cardiac output. Option C. Implement a program of resistance training with heavy weights and low repetitions, emphasizing maximal muscle hypertrophy to increase overall metabolic demand and potentially improve blood flow. Option D. Prioritize low-impact aerobic activities that promote sustained, rhythmic muscle contractions in the affected limbs, thereby enhancing local blood flow and improving endothelial function, while closely monitoring for signs of claudication. The correct answer is D. Prioritize low-impact aerobic activities that promote sustained, rhythmic muscle contractions in the affected limbs, thereby enhancing local blood flow and improving endothelial function, while closely monitoring for signs of claudication. Explanation. The analysis reveals a scenario where a medical exercise program director, MEPD, must assess the impact of compromised blood circulation on a client's exercise capacity and safety. This is professionally challenging because it requires integrating knowledge of physiological responses to exercise with an understanding of specific client contraindications and the regulatory framework governing exercise prescription for individuals with medical conditions. Careful judgment is required to balance the benefits of exercise with the potential risks associated with impaired circulation. The correct approach represents best professional practice because it prioritizes client safety and adherence to established medical exercise guidelines. By considering the client's specific circulatory limitations, the MEPD can tailor an exercise program that is both effective and safe, minimizing the risk of adverse events. This aligns with the ethical imperative to act in the best interest of the client and the regulatory expectation for qualified professionals to conduct thorough assessments and implement appropriate exercise modifications. The focus on understanding the physiological mechanisms of blood flow during exercise and how these are affected by the client's condition is paramount. An incorrect approach that focuses solely on general exercise principles without accounting for the client's circulatory issues would be a regulatory and ethical failure. It neglects the specific needs and risks of the individual, potentially leading to overexertion, exacerbation of the circulatory condition, or other adverse health outcomes. Another incorrect approach that relies on anecdotal evidence or unverified claims about exercise and circulation would also be a failure, as it deviates from evidence-based practice and established professional standards, potentially exposing the client to harm and violating the duty of care. A third incorrect approach that overlooks the importance of monitoring vital signs during exercise in a client with compromised circulation would be a significant ethical lapse and a potential violation of regulatory requirements for client safety and supervision. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the client's medical history and current condition, paying close attention to any documented circulatory impairments. 2. Consult relevant medical documentation, and if necessary, communicate with the client's healthcare provider to gain a comprehensive understanding of their limitations and any specific exercise recommendations or contraindications. 3. Apply knowledge of exercise physiology, specifically how blood circulation is affected by different types of exercise and intensities. 4. Design an exercise program that is individualized, progressive, and takes into account the client's circulatory status, incorporating appropriate modifications and safety precautions. 5. Implement continuous monitoring of the client's response to exercise, including vital signs and subjective feedback, and be prepared to adjust the program as needed. Question 5. Strategic planning requires a medical exercise program director, MEPD, to consider a client's expressed desire for a very high-frequency, high-intensity exercise program, despite their diagnosed cardiovascular condition, and the MEPD assessment indicating that such parameters significantly exceed recommended guidelines for safe and effective rehabilitation. The MEPD must decide how to proceed while adhering to their professional obligations. Which of the following represents the most appropriate course of action? Option A. Explain to the client the rationale behind the recommended fit parameters for their condition, detailing the potential risks of their preferred approach, and propose a modified program that gradually progresses towards their goals while prioritizing safety and efficacy. Option B. Immediately implement the client's requested high-frequency, high-intensity program to respect their autonomy and perceived needs, assuming they are aware of the risks. Option C. Design a program that superficially incorporates the client's frequency and intensity preferences, but significantly reduces the duration and type of exercise to mitigate perceived risks. Option D. Refuse to design any program for the client, stating that their requests are incompatible with safe medical exercise practices, and advising them to seek a different provider. The correct answer is A. Explain to the client the rationale behind the recommended fit parameters for their condition, detailing the potential risks of their preferred approach, and propose a modified program that gradually progresses towards their goals while prioritizing safety and efficacy. Explanation. This scenario presents a professional challenge because it requires balancing the client's perceived needs and desires with the established principles of safe and effective exercise programming, specifically the FIT principle, within the regulatory framework governing medical exercise program directors, MEPD. The MEPD must act as both an educator and a gatekeeper, ensuring that the program adheres to evidence-based practices while respecting client autonomy. The core of the dilemma lies in the client's insistence on a program that deviates significantly from recommended fit parameters for their condition, potentially compromising their safety and the program's efficacy. The correct approach represents best professional practice because it prioritizes client safety and adherence to the fit principle as mandated by the MEPD regulatory responsibilities. By explaining the rationale behind the recommended fit parameters, educating the client on the risks associated with their preferred approach, and proposing a modified, safer alternative that still incorporates their preferences to some degree, the MEPD upholds their duty of care. This aligns with the ethical obligation to provide competent and evidence-based medical exercise guidance, ensuring that the program is tailored to the client's specific medical condition and exercise capacity, thereby minimizing risk and maximizing potential benefits. This approach also demonstrates a commitment to professional integrity and client well-being, which are foundational to the MEPD role. An incorrect approach that involves immediately acceding to the client's demands without proper explanation or modification would be a significant regulatory and ethical failure. This would constitute a breach of the duty of care, as the MEPD would be knowingly implementing a program that deviates from established safety and efficacy guidelines for the client's condition. This could lead to adverse events, injury, or a lack of progress, all of which could result in professional repercussions and potential legal liability. Furthermore, failing to educate the client about the principles of fit and the rationale behind program design undermines the client's understanding and ability to make informed decisions about their health, which is a core ethical responsibility. Another incorrect approach, that of rigidly refusing any client input and dictating the program without attempting to find common ground or explain the reasoning, also presents ethical challenges. While it might adhere to the fit principle in theory, it fails to acknowledge the client's role in their own rehabilitation and can lead to poor adherence and a strained professional relationship. This approach lacks the collaborative and client-centered aspect that is crucial for successful medical exercise programming. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the client's medical condition, exercise history, and current capabilities. 2. Clearly understand the client's goals and preferences. 3. Apply the FIT principle based on evidence-based guidelines relevant to the client's condition. 4. Identify any discrepancies between the client's preferences and the recommended FIT parameters. 5. Engage in open and honest communication with the client, explaining the rationale behind the recommended FIT parameters, including potential risks of deviation. 6. Explore modifications to the client's preferred approach that can be safely integrated while still adhering to core FIT principles. 7. Document all discussions, assessments, and program modifications. 8. Seek consultation with other healthcare professionals if the situation is complex or outside the MEPD scope of expertise. Question 6. Governance review demonstrates that the Medical Exercise Program Director, MEPD, is responsible for overseeing exercise programs designed to improve the respiratory function of clients with various pulmonary conditions. Considering the established regulatory framework for MEPD, which of the following best describes the appropriate approach to explaining the impact of exercise on respiratory function to clients and stakeholders? Option A. Recommend high-intensity interval training for all clients with any respiratory impairment, regardless of their specific condition or current functional capacity, based on its perceived effectiveness. Option B. Articulate how specific exercise modalities can enhance respiratory muscle strength, improve ventilation efficiency, and increase exercise tolerance in individuals with pulmonary limitations, while emphasizing that exercise is a supportive intervention and not a cure for underlying diseases. Option C. Assert that regular exercise can completely reverse the progression of chronic obstructive pulmonary disease, COPD, and asthma, leading to a full recovery of lung capacity. Option D. Focus on anecdotal success stories of individuals who experience significant respiratory improvements after starting an exercise program, without detailing the physiological mechanisms or acknowledging potential risks. This represents a failure in professional duty of care and a potential violation of regulatory guidelines that mandate client assessment and risk management. The MEPD is expected to integrate knowledge of respiratory physiology with individual client health profiles to ensure safety and optimize outcomes, rather than applying a one-size-fits-all approach. A third incorrect approach is to rely solely on anecdotal evidence or personal experience when designing exercise programs for individuals with respiratory conditions. While experience is valuable, the regulatory framework for MEPD emphasizes evidence-based practice. Relying solely on anecdotes can lead to the implementation of ineffective or potentially harmful interventions, failing to meet the standard of care expected, and potentially violating regulatory requirements for program design and client management. Professional reasoning. Professionals should adopt a decision-making process that begins with a comprehensive understanding of the relevant regulatory framework and scope of practice. This is followed by a thorough assessment of the client's individual health status, including any respiratory conditions and their severity. Next, the professional should consult current, evidence-based scientific literature regarding the impact of exercise on respiratory function, specifically as it pertains to the client's condition. Finally, the professional must integrate this knowledge to design a safe, effective, and individualized exercise program that aligns with regulatory requirements and ethical obligations, always prioritizing client well-being and avoiding any claims or actions that fall outside their defined professional scope. Question 7. During the evaluation of a client with a history of cardiovascular disease who expresses a strong desire to incorporate high-intensity interval training, HIIT, into their program, what is the most appropriate initial course of action for the Medical Exercise Program Director, MEPD, to ensure client safety and adherence to regulatory guidelines? Option A. Obtain updated medical clearance from the client's physician and conduct a thorough physiological assessment to determine the client's current cardiovascular and metabolic response to exercise before considering any HIIT protocols. Option B. Inform the client that HIIT is generally contraindicated for individuals with cardiovascular disease and suggest they focus on lower-intensity aerobic activities without further medical consultation. Option C. Immediately implement a modified HIIT program based on the client's perceived readiness and past athletic experience, assuming their desire indicates they can handle the intensity. Option D. Proceed with the HIIT program as requested, but instruct the client to stop immediately if they experience any discomfort, relying on their self-monitoring to manage risk. The correct answer is A. Obtain updated medical clearance from the client's physician and conduct a thorough physiological assessment to determine the client's current cardiovascular and metabolic response to exercise before considering any HIIT protocols. Explanation: this scenario is professionally challenging because it requires the Medical Exercise Program Director, MEPD, to balance the immediate needs and perceived benefits of a client with the long-term physiological implications and the established safety protocols. The MEPD must exercise sound judgment to ensure the client's well-being is prioritized over potentially short-sighted requests, adhering strictly to the established regulatory framework for medical exercise programs. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the client's physiological status before implementing any new exercise modality. This aligns with the core principles of medical exercise, which mandate a thorough understanding of a client's condition, contraindications, and appropriate progression. By consulting with the client's physician and conducting a detailed physiological assessment, the MEPD ensures that the proposed exercise is safe, effective, and tailored to the client's specific needs and limitations, thereby upholding the highest ethical and professional standards. This proactive and collaborative approach minimizes risk and maximizes the potential for positive health outcomes, as expected within the regulatory guidelines governing medical exercise programs. An incorrect approach that involves immediately incorporating the requested high-intensity interval training, HIIT, without proper medical clearance or physiological assessment, represents a significant regulatory and ethical failure. This bypasses the fundamental requirement for physician approval for clients with cardiovascular conditions, as stipulated by the regulatory framework. It also demonstrates a disregard for the client's physiological safety, potentially leading to adverse events such as myocardial infarction or exacerbation of their existing condition. Furthermore, failing to conduct a baseline physiological assessment before introducing a demanding exercise protocol violates the principle of individualized programming and evidence-based practice, which are cornerstones of responsible medical exercise. Another incorrect approach, which involves proceeding with the HIIT program based solely on the client's perceived readiness and past athletic experience, is also professionally unacceptable. While client input is valuable, it cannot supersede objective medical assessment and established safety protocols. Relying on subjective feelings or historical performance without considering the current physiological state and the impact of the client's cardiovascular condition is a direct contravention of the regulatory mandate to operate within a medically supervised framework. This approach risks overexertion, injury, and a failure to manage the client's underlying health condition appropriately. The professional decision-making process for similar situations should involve a systematic approach. 1. Prioritize safety and medical clearance. Always ensure that the client has received appropriate medical clearance for exercise, especially those with pre-existing conditions. 2. Conduct comprehensive physiological assessment. Gather objective data on the client's current physiological status, including cardiovascular function, musculoskeletal integrity, and metabolic markers, as relevant to their condition. 3. Collaborate with healthcare professionals. Maintain open communication with the client's physician and other relevant healthcare providers to ensure a coordinated approach to care. 4. Individualize exercise prescription. Develop exercise programs that are specifically tailored to the client's unique needs, goals, limitations, and current physiological capacity based on evidence and assessment findings. 5. Progress gradually and monitor closely. Implement exercise progressions cautiously, continuously monitoring the client's response and making adjustments as necessary. 6. Educate the client. Ensure the client understands their condition, the rationale behind the exercise program, and the importance of adhering to prescribed protocols. Question 8. Risk assessment procedures indicate a client with a history of peripheral neuropathy reports feeling significantly stronger and more balanced during their current medical exercise program. They are eager to increase the intensity of their exercises. As the medical exercise program director, what is the most appropriate next step to ensure their safety and program efficacy, considering the potential impact on central and peripheral nervous system functions? Option A. Conduct a comprehensive reassessment of the client's neurological function, including balance, proprioception, and motor control, before considering any adjustments to exercise intensity. Option B. Immediately increase the intensity of all prescribed exercises to match the client's perceived improvement and eagerness. Option C. Implement a standardized increase in exercise intensity across all modalities, assuming general physiological adaptation has occurred. Option D. Advise the client that subjective feelings of improvement are not a reliable indicator, and dismiss their request for increased intensity without further evaluation. The correct answer is A. Conduct a comprehensive reassessment of the client's neurological function, including balance, proprioception, and motor control, before considering any adjustments to exercise intensity. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the medical exercise program director, MEPD, to balance the immediate need for a client's comfort and perceived progress with the fundamental responsibility to ensure safety and adherence to established medical exercise protocols. The client's subjective experience of improvement is not always a reliable indicator of physiological readiness for increased intensity, especially when dealing with conditions affecting the central and peripheral nervous systems. Overlooking potential neurological contraindications or exacerbating underlying issues due to premature progression could lead to serious adverse events, violating the core duty of care. Correct approach analysis. The correct approach prioritizes a thorough, objective assessment of the client's neurological status before considering any increase in exercise intensity. This aligns with best professional practice by adhering to the principle of first, do no harm, non-maleficence. Specifically, it necessitates a review of the client's medical history, current symptoms, and objective functional measures that assess neurological integrity, e.g., balance, coordination, proprioception, motor control, sensory feedback. This systematic evaluation ensures that any proposed program modifications are based on evidence of physiological adaptation and are safe, rather than solely on subjective client feedback. This approach is ethically mandated by the responsibility to provide competent and safe care, and it is implicitly supported by regulatory frameworks that require professionals to operate within their scope of practice and to ensure client safety. Incorrect approaches analysis. One incorrect approach involves immediately increasing exercise intensity based solely on the client's subjective report of feeling better. This fails to acknowledge the complexities of neurological conditions, where subjective feelings may not correlate with objective physiological improvements or could even mask underlying issues. This approach risks exacerbating the condition, leading to injury or a decline in function, which is a direct violation of the duty of care and ethical principles of beneficence and non-maleficence. Bypasses essential safety checks and objective assessment, which are fundamental to responsible practice. Another incorrect approach is to dismiss the client's subjective report entirely and refuse any program modification without further investigation. While caution is important, completely disregarding client feedback can erode trust and rapport, potentially leading to non-adherence. Ethically, it fails to acknowledge the client's experience and their role in their own rehabilitation. While not as immediately dangerous as the first incorrect approach, it is less effective in fostering a collaborative and supportive therapeutic relationship, which is crucial for long-term success. A third incorrect approach is to implement a generic increase in intensity across all exercise modalities without considering the specific impact on the client's neurological system. This demonstrates a lack of understanding of how different exercise types might differentially affect central and peripheral nervous system functions. For example, exercises requiring fine motor control or balance might be contraindicated for progression, even if gross motor strength has improved. This approach is a failure of professional competence and a breach of the duty to provide individualized and evidence-based care, potentially leading to unintended negative consequences. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive understanding of the client's condition and its impact on neurological function. This involves active listening to the client's subjective reports, but critically evaluating them against objective data. The process should include 1. thorough review of medical history and current status. 2. Objective assessment of relevant neurological and functional parameters. 3. Consideration of potential contraindications and risks associated with proposed program changes. 4. Development of a safe and individualized plan that prioritizes client well-being. And 5. Ongoing monitoring and reassessment. This structured approach ensures that decisions are evidence-based, client-centered, and ethically sound, minimizing risk and maximizing the potential for positive outcomes. Question 9. Governance review demonstrates that the Medical Exercise Program Director, MEPD, is responsible for overseeing participant progress and safety. During a session, a participant exhibits a significantly elevated heart rate and a noticeable increase in perceived exertion beyond expected levels for the prescribed intensity. Which of the following actions best aligns with the MEPD regulatory responsibilities concerning acute responses? Option A. Modify the exercise intensity downwards without documenting the initial elevated response or consulting any established protocols, based on a subjective assessment of the participant's current state. Option B. Advise the participant to push through the discomfort, assuming it is a normal adaptation to the exercise, and continue with the prescribed routine to build resilience. Option C. Immediately cease the exercise, document the observed responses, and consult the participant's medical file and establish program protocols for guidance on appropriate adjustments or further assessment. Option D. Suggest the participant take a break and return for the next scheduled session without any specific intervention or documentation of the acute physiological response observed. The correct answer is C. Immediately cease the exercise, document the observed responses, and consult the participant's medical file and establish program protocols for guidance on appropriate adjustments or further assessment. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the Medical Exercise Program Director, MEPD, to interpret and apply regulatory guidance concerning the acute physiological responses of participants to exercise, specifically heart rate, stroke volume, and oxygen uptake. The challenge lies in ensuring that the program's protocols align with established safety and efficacy standards, as defined by the relevant regulatory framework, without overstepping the scope of practice or misinterpreting physiological data. Accurate assessment and appropriate program modification based on these responses are critical for participant safety and program effectiveness. Correct approach analysis. The correct approach involves a thorough understanding of the MEP-defined scope of practice and the specific regulatory requirements governing medical exercise programs within the specified jurisdiction. This approach prioritizes adherence to established protocols and guidelines that dictate how acute physiological responses should be monitored and interpreted. It emphasizes the importance of documenting these responses and using them to inform individualized exercise prescription and progression, ensuring that the program remains within safe and effective parameters as mandated by the regulatory framework. This aligns with the ethical obligation to provide safe and evidence-based care. Incorrect approaches analysis. An incorrect approach would involve making unilateral decisions about program modifications based on personal interpretation of physiological data, without consulting or adhering to the established regulatory framework or the guidance of supervising medical professionals. This could lead to unsafe exercise intensities, inadequate progression, or failure to identify potential contraindications, thereby violating regulatory mandates for participant safety and program oversight. Another incorrect approach would be to ignore or inadequately document acute physiological responses, which would be a direct contravention of guidelines requiring systematic monitoring and record keeping, potentially compromising the program's integrity and the participant's well-being. Furthermore, an incorrect approach might involve extrapolating findings or implementing interventions beyond the MEP-defined scope of practice, which would be a regulatory and ethical breach. Professional reasoning. Professionals should approach such situations by first consulting the specific regulatory framework and internal program guidelines. They must clearly understand their scope of practice and the reporting structures in place. When interpreting acute physiological responses, the decision-making process should involve comparing observed data against established normative ranges and program-specific targets. Any deviations or concerns should be addressed through established protocols, which may include consultation with a supervising physician or other healthcare professionals, and documented meticulously. The focus should always be on participant safety, program efficacy, and strict adherence to regulatory requirements. Question 10. Regulatory review indicates a client with a history of bilateral rotator cuff tears and persistent shoulder pain presents for a medical exercise program. The client expresses a desire to improve overhead lifting capacity and reduce daily discomfort. Which of the following approaches best aligns with best practices for managing this client's musculoskeletal condition? Option A. Focus exclusively on passive stretching and manual therapy techniques to alleviate pain without incorporating active strengthening exercises. Option B. Design a program based on general upper body exercises found in popular fitness magazines, assuming a standard approach will be effective for most individuals with shoulder pain. Option C. Immediately initiate a high-intensity resistance training program targeting major upper body muscle groups to build overall strength and compensate for the shoulder weakness. Option D. Implement a progressive exercise program starting with exercises focused on scapular stabilization and rotator cuff activation, gradually increasing intensity and complexity based on the client's pain response and functional improvements. The correct answer is D. Implement a progressive exercise program starting with exercises focused on scapular stabilization and rotator cuff activation, gradually increasing intensity and complexity based on the client's pain response and functional improvements. Explanation. Scenario analysis. This scenario presents a common challenge for medical exercise program director, MEPD, involving a client with a history of rotator cuff tears and ongoing shoulder pain. The challenge lies in balancing the client's desire for functional improvement and pain reduction with the imperative to avoid exacerbating their condition or causing further injury. The MEPD must navigate the complexities of musculoskeletal rehabilitation, considering the client's specific injury history, current pain levels, and the potential risks associated with exercise. This requires a nuanced understanding of exercise physiology, biomechanics, and the client's individual response to intervention, all within the bounds of professional responsibility and regulatory compliance. Correct approach analysis. The correct approach emphasizes a thorough, individualized assessment and a progressive, evidence-based exercise strategy. This aligns with best practices in medical exercise, prioritizing client safety and efficacy. A comprehensive assessment, including range of motion, strength testing, and functional movement analysis, is crucial for identifying specific deficits and limitations related to the rotator cuff pathology. Developing a program that starts with low-intensity, controlled movements focusing on scapular stability and rotator cuff activation, gradually progressing to more challenging exercises as tolerated, is paramount. This phased approach, guided by the client's pain response and functional improvements, minimizes risk and maximizes the likelihood of positive outcomes. This methodology directly supports the MEPD ethical obligation to provide competent care and adhere to professional standards of practice, ensuring that interventions are tailored to the individual's needs and capabilities, thereby preventing harm. Incorrect approaches analysis. An approach that immediately implements high-intensity resistance training without a foundational assessment or consideration of the client's pain is a significant regulatory and ethical failure. This demonstrates a disregard for the client's specific condition and a potential violation of the duty of care, as it could lead to re-injury or aggravation of the rotator cuff tears. Similarly, an approach that relies solely on general stretching exercises without addressing underlying strength deficits or scapular dyskinesis would be inadequate and potentially ineffective, failing to meet the client's rehabilitation goals and potentially overlooking critical components of recovery. Furthermore, an approach that ignores the client's reported pain during exercise and pushes them through discomfort is a direct contravention of ethical practice, prioritizing perceived progress over client well-being and safety, and potentially leading to adverse events. Professional reasoning. When faced with a client presenting with a history of musculoskeletal injury and ongoing pain, the MEPD must adopt a systematic and client-centered decision-making process. This begins with a comprehensive, individualized assessment to understand the nature and extent of the condition. Following the assessment, the MEPD should develop a program based on evidence-based principles, prioritizing safety, gradual progression, and client feedback. Regular monitoring of the client's response to exercise, including pain levels, functional improvements, and any signs of adverse reactions, is essential for making informed adjustments to the program. This iterative process ensures that the exercise intervention remains appropriate and effective, upholding the highest standards of professional practice and regulatory compliance. Question 11. Cost-benefit analysis shows that implementing a comprehensive bone density screening protocol for all new clients would be prohibitively expensive and time-consuming for the clinic. A new client presents with a history of fractures and expresses concern about their bone health, but has not had a recent bone density scan and has no specific physician's orders regarding exercise for bone health. As the Medical Exercise Program Director, MEPD, what is the most appropriate initial course of action to ensure the client's safety and the efficacy of their exercise program? Option A. Proceed with a general exercise program, assuming the client's bones are healthy enough for standard activities. Option B. Design a high-impact exercise program focused on aggressive bone strengthening, as this is generally beneficial for bone density. Option C. Request a physician's clearance and specific exercise recommendations related to bone health before designing the program. Option D. Advise the client that bone health is outside the scope of the MEPD services and suggest they consult a physician independently. The correct answer is C. Request a physician's clearance and specific exercise recommendations related to bone health before designing the program. Explanation. Scenario analysis. This scenario presents a common challenge for a medical exercise program director, MEPD, where a client's bone health is a significant concern, but the available diagnostic information is limited. The MEPD must balance the need for appropriate exercise prescription with the ethical and regulatory imperative to operate within their scope of practice, avoiding overstepping into medical diagnosis or treatment. The challenge lies in interpreting existing information and making informed decisions without definitive medical clearance for specific bone conditions. Correct approach analysis. The correct approach prioritizes client safety and adheres to the MEPD professional scope by seeking clarification from the client's physician. This aligns with regulatory frameworks that mandate collaboration with healthcare professionals when a client presents with potential medical conditions that could impact exercise programming. It demonstrates a commitment to evidence-based practice and patient-centered care, ensuring that the exercise program is tailored to the client's actual physiological status and medical history, as confirmed by a qualified medical practitioner. This proactive communication prevents potential harm and ensures that the MEPD is acting on the most accurate and up-to-date medical information. Incorrect approaches analysis. One incorrect approach involves proceeding with a generalized bone strengthening program without further medical consultation. This fails to acknowledge the potential risks associated with undiagnosed or poorly managed bone conditions, such as osteoporosis or osteopenia. It could lead to injury, exacerbation of the condition, and potential liability for the MEPD, violating ethical principles of do no harm and regulatory requirements to ensure client safety. Another incorrect approach is to dismiss the client's bone health concerns as outside the MEPD purview and proceed with a standard, non-bone-focused program. While the MEPD is not a physician, ignoring a significant client concern that directly impacts exercise capacity and safety is professionally negligent. It fails to uphold the duty of care and the principle of individualized programming, potentially leading to an ineffective or even detrimental exercise plan. A third incorrect approach is to attempt to diagnose the bone condition or prescribe specific medical interventions. This constitutes practicing outside the scope of the MEPD professional license and training, which is a clear regulatory violation and an ethical breach. Medical diagnosis and treatment are the exclusive domain of licensed physicians and other qualified healthcare providers. Professional reasoning. When faced with a client presenting with potential medical conditions that could impact exercise programming, the professional decision-making process involves 1. Recognizing the limitation of one's scope of practice. 2. Prioritizing client safety above all else. 3. Actively seeking necessary information from appropriate sources, typically the client's physician. 4. Communicating clearly with the client about the need for medical clearance or further information. 5. Developing an exercise program that is safe, effective, and evidence-based, informed by medical guidance. Question 12. The assessment process reveals that a client with a history of mild hypertension, currently managed with medication, experiences a gradual increase in heart rate from 70 bpm to 100 bpm, and a rise in systolic blood pressure from 130 mmHg to 145 mmHg during a moderate-intensity aerobic exercise session. The client reports feeling slightly warmer but denies any shortness of breath, chest discomfort, or dizziness. Based on your understanding of heart anatomy and physiology, what is the most appropriate immediate course of action? Option A. Instruct the client to reduce the exercise intensity significantly and perform breathing exercises to lower their heart rate and blood pressure. Option B. Immediately terminate the exercise session and advise the client to rest, as any increase in blood pressure during exercise is a contraindication. Option C. Continue the exercise session at the current intensity, closely monitoring the client's vital signs and subjective symptoms, and document the findings. Option D. Assume the client's medication is not effective and recommend they consult their physician for a medication adjustment before continuing exercise. The correct answer is C. Continue the exercise session at the current intensity, closely monitoring the client's vital signs and subjective symptoms, and document the findings. Explanation. Scenario analysis. The scenario presents a challenge for a medical exercise program director, MEPD, as it requires them to interpret a client's physiological response to exercise in the context of their known cardiac condition. This necessitates a nuanced understanding of heart anatomy and physiology to differentiate between normal adaptive responses and potentially pathological signs, ensuring client safety and program efficacy. The MEPD must also consider the specific regulatory framework governing their practice, which emphasizes client well-being and adherence to established protocols. Correct approach analysis. The correct approach involves recognizing that a slight, transient increase in heart rate and blood pressure during exercise is a normal physiological adaptation. This understanding, grounded in the principles of cardiovascular physiology, allows the MEPD to differentiate this from a concerning sign. The MEPD responsibility, as dictated by professional standards and likely regulatory guidelines for allied health professionals, is to monitor these vital signs, ensure they return to baseline post-exercise, and document the findings. This approach prioritizes client safety by avoiding unnecessary alarm, while maintaining vigilance for any deviations that might warrant further medical attention. It aligns with the ethical obligation to provide evidence-based care and to act within the scope of practice, which includes understanding normal physiological responses to exercise. Incorrect approaches analysis. One incorrect approach would be to immediately cease exercise and escalate to a physician based on any elevation in heart rate or blood pressure, regardless of magnitude or duration. This demonstrates a lack of understanding of normal physiological responses to exercise, which is a fundamental aspect of heart anatomy and physiology relevant to an MEPD. Ethically and professionally, this overreaction can lead to unnecessary anxiety for the client, potentially hinder their progress, and misallocate medical resources. It fails to adhere to the principle of proportionality in clinical decision-making. Another incorrect approach would be to ignore the observed changes in heart rate and blood pressure, attributing them to external factors or simply not monitoring them closely. This represents a failure to uphold the duty of care and a significant lapse in professional responsibility. Regulatory frameworks for health professionals invariably mandate diligent monitoring of clients during exercise, especially those with pre-existing conditions. Such negligence could have severe consequences if a genuine adverse event were to occur and go unnoticed, leading to potential disciplinary action and legal ramifications. A third incorrect approach would be to interpret the physiological changes based on anecdotal evidence or personal assumptions, rather than established physiological principles and the client's specific medical history. This deviates from evidence-based practice and the requirement to apply scientific knowledge. It is professionally unsound and ethically questionable to make clinical judgments without a solid foundation in the relevant anatomy, physiology, and the client's individual health profile. Professional reasoning. When faced with a client exhibiting physiological changes during exercise, the MEPD should employ a systematic decision-making process. This begins with a thorough understanding of the client's medical history and the normal physiological responses of the cardiovascular system to exercise. The MEPD must then accurately monitor the client's vital signs, comparing them against expected norms for that individual and the exercise intensity. If the observed changes are within expected parameters and transient, the program can continue with close observation. If the changes are excessive, persistent, or accompanied by other symptoms, the MEPD must follow established protocols for escalation, which typically involves consulting with the referring physician or other appropriate healthcare professionals. This process ensures client safety, promotes effective exercise programming, and upholds professional and regulatory standards. Question 13. Implementation of a new medical exercise program for a patient diagnosed with type 2 diabetes presents an opportunity to significantly improve their glycemic control and overall health. As the Medical Exercise Program Director, MEPD, what is the most appropriate initial step to ensure the exercise intervention is safe and effective for this individual? Option A. Rely on the patient's self-reported fitness level and their stated desire to engage in moderate-intensity aerobic exercise 3 times per week. Option B. Conduct a comprehensive health screening, including a review of their medical history, current medications, and any physician recommendations, followed by a functional movement assessment to inform an individualized exercise prescription. Option C. Immediately prescribe a high-intensity interval training (HIIT) program, as this has shown significant benefits for glycemic control in research studies. Option D. Begin a general exercise program that includes a mix of cardiovascular and resistance training, assuming that any form of exercise will be beneficial for diabetes management. The correct answer is B. Conduct a comprehensive health screening, including a review of their medical history, current medications, and any physician recommendations, followed by a functional movement assessment to inform an individualized exercise prescription. Explanation. This scenario presents a common implementation challenge for a medical exercise program director, MEPD, when integrating exercise into the management of a chronic disease, specifically type 2 diabetes. The challenge lies in balancing the established benefits of exercise with the individual patient's specific health status, potential contraindications, and the need for a structured, evidence-based approach that aligns with regulatory expectations for patient care. A key aspect of professional responsibility for an MEPD is ensuring that exercise interventions are safe, effective, and tailored to the individual, while also adhering to the principles of medical exercise programming. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment before initiating any exercise program. This aligns with the fundamental ethical and regulatory principles of patient-centered care, risk mitigation, and evidence-based practice. By consulting with the patient's physician, reviewing their medical history, and conducting a thorough functional assessment, the MEPD ensures that the exercise plan is appropriate for the patient's current health status, considering any comorbidities or limitations. This proactive approach minimizes the risk of adverse events and maximizes the potential for positive health outcomes, directly supporting the goal of effective disease management through exercise. This aligns with the overarching responsibility of an MEPD to act in the best interest of the patient and within the scope of their professional practice, which often necessitates collaboration with other healthcare providers. An incorrect approach that involves immediately prescribing a generic exercise program without adequate assessment fails to meet professional standards. This could lead to adverse events such as hypoglycemia, cardiovascular strain, or musculoskeletal injury, which would not only be detrimental to the patient's health but also expose the MEPD to liability. Ethically, it violates the principle of do no harm. From a regulatory perspective, it demonstrates a lack of due diligence and adherence to established protocols for safe and effective exercise prescription, potentially contravening guidelines that mandate individualized care plans and risk assessment. Another incorrect approach, such as relying solely on the patient's self-reported ability to exercise without objective assessment or physician consultation, is also professionally unacceptable. Patients may overestimate their capabilities or be unaware of subtle contraindications. This approach neglects the MEPD responsibility to provide expert guidance and oversight, increasing the risk of harm and undermining the credibility of the medical exercise program. It fails to uphold the professional standard of care that requires a systematic and informed approach to exercise prescription for individuals with chronic conditions. Finally, an approach that focuses on high-intensity exercise without considering the patient's current fitness level or disease progression is misguided. While exercise is beneficial for type 2 diabetes, the intensity and type of exercise must be carefully calibrated. Prescribing overly strenuous activity without proper assessment can be dangerous and counterproductive, potentially exacerbating existing health issues or leading to burnout and non-adherence. This demonstrates a misunderstanding of exercise physiology and its application in disease management, failing to adhere to the principles of progressive overload and individualization. The professional decision-making process for similar situations should involve a systematic approach. 1. Patient assessment. Conduct a thorough review of the patient's medical history, current health status, and any physician recommendations. 2. Risk stratification. Identify potential risks and contraindications associated with exercise for this specific patient. 3. Goal setting. Collaborate with the patient and their healthcare team to establish realistic and achievable exercise goals aligned with disease management. 4. Program design. Develop an individualized exercise prescription that considers exercise type, intensity, duration, frequency, and progression based on assessment findings. 5. Monitoring and reevaluation. Continuously monitor the patient's response to exercise and adjust the program as needed, maintaining open communication with the patient and their physician. 6. Documentation. Maintain accurate and comprehensive records of all assessments, interventions, and patient progress. Question 14. The efficiency study reveals that the current exercise regimen for a client with a chronic condition has reached a point of diminishing returns in terms of strength gains, yet shows continued, albeit slower, improvements in cardiovascular endurance and flexibility. The MEPD must decide on the most appropriate next step to optimize the client's long-term health outcomes. Option A. Systematically reevaluate the client's strength training program, considering variations in exercise selection, intensity, or volume, while continuing to monitor endurance and flexibility adaptations. Option B. Introduce a completely novel and unproven exercise modality to stimulate new adaptations, disregarding the current study's findings on strength plateaus. Option C. Maintain the current strength training program unchanged, as the study indicates some level of adaptation is still occurring across all parameters. Option D. Immediately discontinue strength training and focus exclusively on maximizing cardiovascular endurance and flexibility, as indicated by the study's findings. The correct answer is A. Systematically reevaluate the client's strength training program, considering variations in exercise selection, intensity, or volume, while continuing to monitor endurance and flexibility adaptations. Explanation. This scenario presents a professional challenge because the medical exercise program director, MEPD, must balance the scientific evidence of chronic adaptations with the practical realities of individual client progress and potential plateaus. The MEPD needs to make informed decisions about program adjustments based on objective data, while also considering the client's subjective experience and overall well-being. This requires a nuanced understanding of exercise physiology and a commitment to evidence-based practice within the regulatory framework governing MEPD. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the client's response to the exercise program. By analyzing the efficiency study's findings in conjunction with the client's specific chronic adaptations, endurance, strength, flexibility, the MEPD can identify potential areas for improvement or modification. This aligns with the ethical obligation to provide safe, effective, and individualized exercise programming, ensuring that the program continues to meet the client's evolving needs and goals. Adherence to established guidelines for program evaluation and modification is paramount. An incorrect approach that focuses solely on the efficiency study's general findings without considering the client's individual adaptations would be a regulatory and ethical failure. This would disregard the principle of individualized care, potentially leading to an ineffective or even detrimental program. Another incorrect approach that involves making significant program changes based on anecdotal client feedback alone, without objective data from the efficiency study or assessment of chronic adaptations, would also be a failure. This bypasses the required data-driven decision-making process and could compromise client safety and program efficacy. Furthermore, ignoring the efficiency study altogether and continuing with the current program without reevaluation would represent a failure to adhere to best practices for program monitoring and adjustment. Professionals should employ a decision-making framework that begins with understanding the client's baseline and goals. This is followed by implementing a program and systematically collecting data on relevant physiological adaptations. The efficiency study provides a valuable tool for objective assessment. The MEPD must then critically analyze this data in the context of the client's individual chronic adaptations, considering any discrepancies or plateaus. Based on this comprehensive analysis, the MEPD can then make informed, evidence-based decisions regarding program modifications, always prioritizing client safety and efficacy within the established regulatory and ethical guidelines. Question 15. The assessment process reveals a client with a history of asthma reports experiencing increased shortness of breath and a mild wheeze during the warm-up phase of their prescribed exercise session. Considering the anatomy of the respiratory system, which of the following represents the most appropriate initial response for the medical exercise program director? Option A. Advise the client to focus on deep diaphragmatic breathing exercises for the remainder of the session to strengthen their respiratory muscles. Option B. Interpret the symptoms as a sign of general deconditioning and increase the overall duration of the exercise program to build endurance. Option C. Immediately cease the exercise session and advise the client to use their rescue inhaler, followed by a thorough review of their breathing mechanics and the potential impact of airway constriction on their exercise capacity. Option D. Continue the exercise session at a reduced intensity, assuming the symptoms are a normal response to exertion for someone with asthma. Correct answer is C. Immediately cease the exercise session and advise the client to use their rescue inhaler, followed by a thorough review of their breathing mechanics and the potential impact of airway constriction on their exercise capacity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical exercise program director, MEPD, to interpret a client's subjective report of breathing difficulties in the context of their known respiratory condition. The MEPD must balance the client's perception with objective anatomical and physiological understanding to ensure safety and program efficacy. Misinterpreting the client's symptoms could lead to inappropriate exercise prescription, potentially exacerbating their condition or causing harm. The MEPD role demands a nuanced approach that integrates client feedback with a thorough understanding of the respiratory system's anatomy and function. Correct approach analysis. The correct approach involves a systematic assessment that considers the anatomical structures of the respiratory system and their potential involvement in the client's reported symptoms. This includes evaluating the upper airway, nasal passages, pharynx, larynx, the lower airway, trachea, bronchi, bronchioles, and the lungs themselves, alveoli. Understanding how inflammation, obstruction, or reduced elasticity in these structures can manifest as shortness of breath, wheezing, or coughing is crucial. The MEPD must correlate these anatomical considerations with the client's specific diagnosis and exercise response, ensuring that the program design directly addresses or safely accommodates the physiological limitations imposed by their respiratory anatomy. This aligns with the professional responsibility to provide evidence-based, individualized care that prioritizes client safety and well-being, as mandated by the principles of medical exercise programming. Incorrect approaches analysis. One incorrect approach would be to dismiss the client's reported symptoms as non-significant without further investigation, assuming their respiratory condition is stable. This fails to acknowledge the dynamic nature of respiratory illnesses and the potential for exercise-induced exacerbations. Ethically, this demonstrates a lack of due diligence and a disregard for the client's subjective experience, which is a critical component of health assessment. Another incorrect approach would be to immediately escalate to the most aggressive intervention or modify the program drastically without a clear understanding of the underlying anatomical or physiological cause of the symptoms. This demonstrates poor clinical reasoning and could lead to unnecessary anxiety for the client or an inappropriate reduction in exercise capacity. It bypasses the necessary diagnostic steps required for effective medical exercise programming. A third incorrect approach would be to focus solely on the client's general fitness level without considering how their specific respiratory anatomy might be compromised during exercise. This overlooks the core principle of medical exercise programming, which is to tailor interventions to the individual's unique medical profile, including their anatomical and physiological limitations. Professional reasoning. When faced with a client reporting breathing difficulties, the MEPD should employ a structured decision-making process. This begins with active listening and detailed symptom clarification. Next, the MEPD must draw upon their knowledge of respiratory anatomy and physiology to hypothesize potential causes related to the client's known condition. This hypothesis guides further assessment, which may include observation of breathing patterns, auscultation, if within scope, and review of objective data. Based on this comprehensive assessment, the MEPD can then make an informed decision about program modification, referral, or continued monitoring, always prioritizing client safety and adherence to best practices in medical exercise. Question 16. Benchmark analysis indicates that a new client presents with a physician's note recommending specific exercise modifications due to a recent cardiac event, but the client expresses a strong desire to perform high-intensity interval training, HIIT, exercises they previously enjoyed. As the Medical Exercise Program Director, MEPD, which of the following approaches best aligns with regulatory requirements and ethical practice for exercise prescription? Option A. Immediately implement the client's preferred HIIT program, assuming their desire indicates a readiness for higher intensity and that the physician's note may be overly cautious. Option B. Design an exercise program that strictly adheres to the physician's recommended modifications, incorporating lower-impact cardiovascular exercises and strength training, while educating the client on the rationale and benefits of this approach for their recovery and long-term health. Option C. Develop a program that includes a mix of the client's preferred HIIT exercises and the physician's recommendations, without further consultation, to satisfy both parties. Option D. Prioritize the client's preference for HIIT and proceed with a modified HIIT program, advising the client to inform their physician of any discomfort experienced during sessions. The correct answer is B. Design an exercise program that strictly adheres to the physician's recommended modifications, incorporating lower-impact cardiovascular exercises and strength training, while educating the client on the rationale and benefits of this approach for their recovery and long-term health. Explanation. This scenario presents a professional challenge because the Medical Exercise Program Director, MEPD, must balance the individual client's perceived needs and preferences with the established evidence-based exercise prescription guidelines and the specific contraindications identified by the client's physician. The MEPD primary responsibility is client safety and efficacy, which necessitates a rigorous, individualized approach to exercise prescription that aligns with medical recommendations. The correct approach represents best professional practice because it prioritizes a thorough assessment of the client's medical history, current physical status, and physician's recommendations before designing an exercise program. This aligns with the core principles of responsible exercise programming, emphasizing safety, individualization, and evidence-based practice. Adhering to physicians' directives is paramount, as it ensures the exercise program does not exacerbate existing conditions or create new risks. The MEPD role is to translate medical guidance into a safe and effective exercise plan, not to override it based on client preference alone. An incorrect approach that involves immediately implementing the client's preferred exercises without a comprehensive assessment and physician consultation would represent a significant regulatory and ethical failure. This could lead to adverse events, injury, or exacerbation of the client's medical condition, violating the duty of care owed to the client. Furthermore, it demonstrates a disregard for the physician's medical authority and expertise, potentially leading to legal repercussions and a breach of professional standards. Another incorrect approach, such as solely relying on general exercise guidelines, without considering the client's specific medical profile and physician's input, also fails to meet the standard of individualized care required by regulatory frameworks governing allied health professionals. This oversight could result in an inappropriate or unsafe exercise prescription. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available medical documentation, including physician's notes and any specific exercise recommendations or restrictions. 2. Conduct a comprehensive client assessment, including functional movement screening, to understand their current capabilities and limitations. 3. Engage in open communication with the client to understand their goals and preferences, while clearly explaining the rationale behind the exercise prescription based on medical guidance and assessment findings. 4. Develop an exercise prescription that is individualized, progressive, and directly addresses the client's needs and goals within the parameters set by their physician. 5. Continuously monitor the client's response to exercise and be prepared to modify the program as needed, always in consultation with medical professionals if significant changes are contemplated. Question 17. Investigation of the most appropriate initial fitness assessment for a new client with a recent diagnosis of type 2 diabetes and mild hypertension, who reports feeling ready to get back into shape. Option A. A brief self-assessment questionnaire on perceived exertion and energy levels to gauge readiness for exercise. Option B. A simple walk test to measure gait speed and distance without further physiological monitoring. Option C. A standardized battery of tests typically used for healthy, athletic populations, assuming the client's reported readiness indicates they can handle it. Option D. A comprehensive assessment including resting heart rate, blood pressure, body composition, cardiovascular endurance, e.g. submaximal treadmill test, muscular strength and endurance, e.g. 1RM or submaximal strength tests and flexibility. The correct answer is D. A comprehensive assessment including resting heart rate, blood pressure, body composition, cardiovascular endurance, e.g. submaximal treadmill test, muscular strength and endurance, e.g. 1RM or submaximal strength tests and flexibility. Explanation. This scenario presents a professional challenge because the medical exercise program director, MEPD, must balance the immediate need for client progress with the paramount importance of safety and adherence to established best practices for fitness assessments. The MEP judgment is critical in selecting an assessment that is both effective and appropriate for the client's current condition, avoiding overestimation of capabilities or underestimation of risks. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized, and evidence-based assessment. This aligns with the ethical obligation to provide safe and effective exercise programming, ensuring that the client's physiological status is thoroughly understood before initiating or progressing an exercise program. Regulatory frameworks for allied health professionals, including those overseeing exercise programs, mandate that assessments be conducted by qualified individuals using validated methodologies that consider the client's medical history and current functional capacity. This approach minimizes the risk of adverse events and maximizes the likelihood of positive outcomes, thereby upholding professional standards and client welfare. An incorrect approach that relies solely on a client's self-reported readiness without objective data fails to meet professional standards. This is because it bypasses the MEP responsibility to conduct a thorough evaluation, potentially leading to inappropriate exercise prescription and increased risk of injury or exacerbation of underlying conditions. Ethically, this constitutes a breach of due diligence. Another incorrect approach that uses a generic, one-size-fits-all assessment without considering the client's specific medical conditions or limitations is also professionally unacceptable. Such an approach disregards the individualized nature of medical exercise and can lead to inaccurate interpretations of fitness levels, potentially causing harm. This violates the principle of providing tailored care and can be seen as negligent. The professional decision-making process for similar situations should involve a systematic evaluation of the client's medical history, current health status, and any contraindications or precautions. The MEP should then select an assessment tool that is validated for the client's specific population and condition, ensuring it can be administered safely and effectively. This process requires critical thinking, a strong understanding of exercise physiology and pathology, and a commitment to ongoing professional development to stay abreast of best practices in fitness assessment for medical populations. Question 18. What factors determine the appropriate exercise prescription for an individual experiencing significant neuromuscular fatigue, specifically concerning the efficiency of the neuromuscular junction and the subsequent ability of muscles to contract effectively? Option A. The availability of standard exercise equipment and the general fitness level of other individuals in a group setting. Option B. Perceived urgency to achieve maximal strength gains within a short time frame, overriding any signs of fatigue. Option C. The individual's current level of perceived exertion, objective measures of neuromuscular function, e.g., reaction time, force production capacity, and the rate of recovery between muscle contractions. Option D. The client's historical exercise performance data from previous training cycles, irrespective of their current fatigue levels. The correct answer is C. The individual's current level of perceived exertion, objective measures of neuromuscular function, e.g., reaction time, force production capacity, and the rate of recovery between muscle contractions. Explanation. This scenario presents a professional challenge for a medical exercise program director, MEPD, by requiring them to adapt exercise programming for an individual experiencing neuromuscular fatigue, a condition directly impacting the neuromuscular junction and muscle contraction. The challenge lies in accurately assessing the individual's current capacity and designing an intervention that promotes recovery and functional improvement without exacerbating the condition, all while adhering to the specific regulatory framework governing MEPD. Careful judgment is required to balance exercise principles with the individual's physiological state and the program's objectives. A correct approach, which focuses on assessing the individual's current neuromuscular capacity through functional movement screens and subjective fatigue reporting, and then tailoring exercise intensity and volume based on these findings, represents best professional practice. This aligns with the ethical obligation of an MEP to provide individualized, evidence-based care. Regulatory guidelines for MEPD emphasize client safety and efficacy, necessitating a personalized approach that accounts for physiological limitations. By prioritizing a gradual progression and monitoring for signs of fatigue, the MEPD ensures the program remains within the client's safe and effective exercise zone, minimizing the risk of adverse events and promoting long-term adherence and progress. An incorrect approach that solely relies on pre-existing exercise protocols without considering the individual's current neuromuscular state fails to acknowledge the dynamic nature of fatigue and its impact on muscle contraction. This could lead to overexertion, further impairing neuromuscular function and potentially causing injury. Ethically, this demonstrates a lack of individualized care and a disregard for the client's immediate physiological needs. Another incorrect approach that prioritizes pushing through fatigue to achieve rapid strength gains ignores the fundamental principles of exercise physiology related to recovery and adaptation. Neuromuscular fatigue directly impairs the efficiency of the neuromuscular junction and subsequent muscle fiber recruitment. Pushing through such fatigue can lead to maladaptive responses, increased risk of injury, and a decline in performance, violating the MEP duty to promote health and well-being. A further incorrect approach that focuses exclusively on cardiovascular conditioning without addressing the underlying neuromuscular limitations would be insufficient. While cardiovascular health is important, it does not directly address the impaired neuromuscular transmission or muscle contraction mechanisms contributing to the fatigue. This approach fails to provide a comprehensive solution to the individual's specific challenges. The professional decision-making process for similar situations involves a systematic evaluation of the client's condition, a thorough understanding of the underlying physiological mechanisms, in this case, neuromuscular junction function and muscle contraction, and the application of evidence-based exercise principles within the established regulatory and ethical boundaries. It requires continuous assessment, adaptation, and clear communication with the client. Question 19. When evaluating a new client diagnosed with osteoarthritis and another with osteoporosis, what is the most effective process optimization strategy for developing their respective medical exercise programs to ensure safety and efficacy? Option A. Proceed with program design immediately after initial client intake, deferring physician clearance and detailed functional assessments until the client has completed several exercise sessions. Option B. Conduct a thorough, individualized assessment for each client, including medical history review, physician clearance, and functional capacity evaluation, to design a phased, progressive exercise program tailored to their specific condition and limitations. Option C. Design exercise programs based solely on general guidelines for musculoskeletal health, without specific consideration for the severity or presentation of each client's diagnosed condition. Option D. Implement a standardized exercise protocol that includes high-impact movements and moderate to heavy resistance training for both clients to maximize potential strength gains. The correct answer is B. Conduct a thorough, individualized assessment for each client, including medical history review, physician clearance, and functional capacity evaluation, to design a phased, progressive exercise program tailored to their specific condition and limitations. Explanation. Scenario analysis. This scenario presents a common challenge for a medical exercise program director, MEPD, involving clients with musculoskeletal disorders like arthritis and osteoporosis. The complexity arises from the need to balance the therapeutic benefits of exercise with the inherent risks associated with these conditions. Osteoporosis increases fracture risk, while arthritis can cause pain, inflammation, and reduce joint mobility. And MEPD must possess a deep understanding of exercise physiology, contraindications, and progression strategies tailored to these specific pathologies, while also adhering to the regulatory framework governing their practice. The challenge lies in optimizing the exercise program for individual client needs and safety, ensuring it aligns with medical recommendations and regulatory expectations for program design and supervision. Correct approach analysis. The correct approach prioritizes a comprehensive, individualized assessment and a phased, progressive exercise strategy. This aligns with best professional practice by ensuring that the exercise program is safe, effective, and evidence-based. Regulatory frameworks for MEP typically mandate that programs are designed based on thorough client evaluations, including medical history, physician's clearance, and functional assessments. A phased approach allows for gradual adaptation, minimizing the risk of exacerbating symptoms or causing injury. This methodology directly addresses the unique vulnerabilities of individuals with arthritis and osteoporosis, promoting long-term adherence and positive health outcomes. It reflects a commitment to client well-being and adherence to professional standards of care, which are often implicitly or explicitly outlined in regulatory guidelines emphasizing client safety and program efficacy. Incorrect approaches analysis. Implementing a standardized, one-size-fits-all exercise protocol for all clients with arthritis or osteoporosis is a significant regulatory and ethical failure. This approach disregards individual differences in disease severity, symptom presentation, and functional capacity, directly violating the principle of individualized care mandated by professional standards and likely by regulatory oversight. It increases the risk of adverse events, such as fractures in osteoporotic individuals or joint damage in those with severe arthritis, leading to potential liability and disciplinary action. Recommending high-impact or overly strenuous exercises without considering the client's current pain levels, joint integrity, or bone density is another critical failure. This demonstrates a lack of understanding of the specific contraindications and precautions associated with these conditions. Such recommendations can lead to immediate injury and long-term detriment to the client's health, contravening the MEP duty of care and potentially violating regulations that require practitioners to operate within their scope of competence and to prioritize client safety. Failing to obtain or review physician clearance and recommendations before designing or modifying an exercise program is a direct regulatory violation. Medical exercise programs operate under the premise of collaboration with healthcare providers. Ignoring physician input undermines the integrated care model and can lead to exercise prescriptions that conflict with medical management, posing a serious risk to the client and violating established practice guidelines and regulatory requirements for interdisciplinary communication and client management. Professional reasoning. When evaluating clients with musculoskeletal disorders, the MEP must adopt a systematic decision-making process. This begins with a thorough review of all available medical documentation and physician recommendations. Following this, a comprehensive individualized assessment is crucial, encompassing functional movement screens, pain assessment, and evaluation of range of motion and strength. Based on this data, the MEP should develop a progressive exercise plan that prioritizes safety, gradual adaptation, and symptom management. Regular reassessment and program modification in response to client feedback and progress are essential. This iterative process ensures that the program remains appropriate and effective, adhering to both ethical obligations and regulatory mandates for client-centered care and risk mitigation. Question 20. Stakeholder feedback indicates that a participant in the medical exercise program who has a history of mild hypertension is reporting feeling stronger than ever and is pushing to increase their exercise intensity beyond the prescribed parameters, stating they feel no adverse effects related to their blood circulation. As the medical exercise program director, what is the most appropriate course of action to ensure the participant's safety and adherence to best practices regarding blood circulation management during exercise? Option A. Immediately halt the current exercise session and require the participant to undergo a comprehensive cardiovascular assessment and obtain updated medical clearance before resuming any exercise. Option B. Pause the current exercise session to conduct a brief, targeted assessment of the participant's heart rate and blood pressure response to the increased intensity, review their medical history for any contraindications, and then make an informed decision about continuing or modifying the session based on these findings. Option C. Advise the participant that while their motivation is commendable, they must strictly adhere to their prescribed intensity to avoid any potential strain on their cardiovascular system, without further immediate assessment. Option D. Allow the participant to continue at their current increased intensity, as they report feeling well and are motivated to progress, with a note to monitor them closely for any subtle changes. The correct answer is A. Immediately halt the current exercise session and require the participant to undergo a comprehensive cardiovascular assessment and obtain updated medical clearance before resuming any exercise. Explanation: this scenario is professionally challenging because it requires the Medical Exercise Program Director, MEPD, to balance the immediate needs and perceived benefits of a participant with the overarching responsibility to ensure safety and adherence to established protocols, particularly concerning blood circulation. The participant's desire to push limits, while understandable, could pose a significant risk if not managed within the established medical exercise framework. Careful judgment is required to assess the participant's physiological response in real time and to make decisions that prioritize their well-being over their immediate performance goals. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the participant's physiological response to exercise, specifically focusing on blood circulation. This aligns with the core principles of medical exercise, which emphasize safety, efficacy, and individualization. By consulting the participant's medical records and potentially seeking further medical clearance, the MEPD is acting within the bounds of professional responsibility and regulatory guidelines that mandate a cautious and informed approach to exercise prescription for individuals with potential underlying health conditions. This proactive stance minimizes risk and ensures that any exercise modifications are made with a clear understanding of the participant's cardiovascular status. An incorrect approach that involves allowing the participant to continue at their current intensity without further assessment is professionally unacceptable due to significant regulatory and ethical failures. This directly contravenes the duty of care owed to the participant. It ignores the potential for exercise-induced cardiovascular compromise, which could lead to adverse events such as arrhythmias, ischemia, or even cardiac arrest. Ethically, it demonstrates a lack of due diligence and a failure to uphold the principle of do no harm. From a regulatory standpoint, it could be seen as negligence, violating standards of practice that require ongoing monitoring and risk management. Another incorrect approach, which involves immediately terminating the exercise session and imposing a strict, long-term restriction without a proper physiological assessment, is also professionally flawed. While safety is paramount, an overly restrictive approach without a clear, evidence-based rationale can be detrimental to the participant's long-term health and adherence to exercise. It fails to acknowledge the potential for adaptation and improvement with appropriate exercise progression. Ethically, it may be perceived as paternalistic and may undermine the participant's autonomy and motivation. Regulatory failure lies in not following a systematic process of assessment and individualized prescription. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize and assess the immediate concern. Identify any signs or symptoms that suggest a potential issue with blood circulation or cardiovascular response. 2. Consult available data. Review the participant's medical history, exercise prescription, and any pre-exercise assessments. 3. Perform a targeted assessment. If necessary, conduct immediate physiological monitoring, e.g., heart rate, blood pressure, perceived exertion to gather real-time data. 4. Consult relevant protocols and guidelines. Refer to established medical exercise guidelines and the participant's specific medical clearance. 5. Make an informed decision. Based on the gathered information, decide whether to continue, modify, or temporarily halt the exercise. 6. Communicate and document. Clearly communicate the decision and rationale to the participant and meticulously document all findings and actions taken. 7. Follow up and reevaluate. Plan for appropriate follow-up and reevaluation to ensure the participant's ongoing safety and progress.